Thank you. Let me start by saying that the National Aging and Disability Transportation Center is a new center. We began operation 2 years ago, so we're now in our third year. Prior to this, there were two different separate centers that were funded by the Federal Transit Administration, the National Center on Senior Transportation, and under our work through the National Center on Senior Transportation, one of our focuses was on diversity. We had a diversity committee. We did some work on American Indians, and we still have that information available on the NADTC website. So let me do this. Okay, so let me say a few words about our center and what our mission is, so that folks understand why we're here. We are one of four National Technical Assistance Centers that are funded by the Department of Transportation. They include us. We're a fairly new kid on the block. Actually, the newest kid on the block is the Shared Use Mobility Center, which looks at shared rides, particularly. There's also the National Center on Mobility Management and the National Rural Assistance Transportation Program, which really looks at transportation, particularly public transportation, in rural areas and in tribal areas. So our center is focused on older adults and people with disabilities. And our mission is all about access. Now we do some work on the ADA and access under the ADA, the requirements of the ADA related to transportation. But for the most part, we think about access in a much broader way. How easy is it for people to get transportation in their community? That really is the critical question. Our work is focused on a number of different areas, and one of those areas is person-centered information and technical assistance. We work primarily with professionals in the field, people who work in transportation, people who work in aging programs, as well as disability programs. One of our prime audiences are area agencies on aging and public transit, and centers for independent living. But we work with anyone who has an interest in those areas. We have a toll-free number, a national toll-free number, and more than half of our calls actually come from older adults and family caregivers. And those calls are often from people who say, I have a medical appointment tomorrow, and my ride plan fell through. How am I going to get there? That is really a very common kind of question. And because we continue to get those calls, and because really part of our mission is to serve older adults and people with disabilities and family caregivers, we have a relationship with an organization called the Elder Care Locator. Now, the Elder Care Locator is a national toll-free number. It is supported by the U.S. Administration for Community Living. It's been in existence for more than 20 years. And the organization I work for, which is the National Association of Area Agencies on Aging, it operates that center under a contract with ACL. They handle calls from older people about isolation, needing home care services, needing a ride to various and sundry places. They get questions about Social Security, about Medicare, about Medicaid. The most common call that they get is about transportation. And the most usual call that they get is just what I told you. People who are looking for rides for medical appointments. And they have a process of connecting people locally to a local information line, whoever operates that. It may be operated by 211, it may be operated by a Center for Independent Living, It may be operated by the Area Agency on Aging or one of its contract partners. And it may also be an aging and disability resource center, which has a broad mandate to handle issues related to long-term services and supports in the community. NADTC is a partnership of N4A and Easter Seals. Easter Seals brings to the table years of experience and knowledge about transportation for people with disabilities. Our perspective from N4A, which is where I work, is on the aging network and connectedness to those services that older adults need to live and thrive in the community. And as I said, we're funded by the Federal Transit Administration. The other thing that we do is we do a lot of training, webinars, and online courses, and presentations at conferences such as this. And we do a lot of communication. So our website is meant to be very interactive. It's meant to be a clearinghouse on publications of various kinds. And it's meant to support the field, just in general. We do a lot of coordination and partnership. That's part and parcel of our work. And we invest in community solutions, and I will be talking a little bit about some of the local projects that we have supported over the past couple of years. And finally, we look at identifying best practices and developing products that respond to what we hear from the field in terms of what's most important. I've really already talked about our primary target audiences. These are a couple of examples of recent publications. This publication over here called Transportation Options is something that we did in partnership with the Elder Care Locator. And that publication is meant primarily for older adults, people with disabilities, and family caregivers, but it's also useful for community resources. So let me say a few words about why we think transportation is important. I've got a few statistics up here. I'm sure they're familiar with many people, to many people in the room. We've already talked about the fact that most older people outlive their ability to drive, and there's going to be a point in their lives when either they are reducing their driving because they have concerns about safety, or someone else forces them to stop driving, often a family member. And that has a profound impact on people's lives, not just making it more difficult for them to get to the doctor, but making it more difficult for them to live and stay connected to the community, obviously a connection to social isolation. Half of older non-drivers don't leave their home every day. That's a lot of people staying at home and being lonely. And 3.6 million Americans miss or delay non-emergency medical care every year because they can't get there. And that's a major economic issue for medical offices and others who are involved in providing care and support to older people when people don't come to the appointment that they've made. I will say that the other issue I want to really point out is the fact that 78% of family caregivers do some transportation. We recently held a meeting in Prince George's County, Maryland, which is a suburban county outside of DC, and we had family caregivers come to this meeting, and most of the meeting was really the family caregivers talking with each other and then talking to everybody in the room about some of the transportation challenges that they face. And a lot of these family caregivers are doing so much transportation. And just because they live in a place with a lot of transportation resources doesn't necessarily mean that they perceive that they can use those transportation resources. A lot of concerns about loved ones not being able to travel alone. So having access to a program that provides assistance and a personal individual, who can travel with that individual, is really critically important. And really, one of the reasons why a lot of family caregivers are unable to continue work is because of the amount of absences they have to experience from work while they're taking their loved ones to the doctor, to the physical therapist, etc. And transportation, as I said earlier, is the #1 reason why people call the elder care locator. So I want to emphasize the fact that when we're talking about community transportation, we are not just talking about public transit. Though public transit is very important, and the extent to which people can use public transit is something that I think we all should be committed to ensuring. That public transit is not just responsive to the general population, but that older adults and people with disabilities can be well served by public transit. And to some degree that means overcoming barriers to people's resistance to using public transit. So I include things like travel training up here on this list because it's really important for people to be exposed to not just public transit, but other kinds of transportation that may be available in the community that they may not have been aware of, but they also may not know how to use or not be comfortable with. And they need a gradual introduction to using those services, and that's really an important part of the community supports that enable people not to be isolated. Paratransit, taxis, we've talked about a lot of these things, the transportation voucher programs. I won't go over this, but I will say that in the work that we have done over the last several years, and I've been with N4A working on transportation issues since 2008, there are two big issues that I think are outstanding, no matter where the community is. One is there transportation that older adults in the community can use? So it isn't just, do we have any transportation, but is transportation something that people can use? And then the second issue, which is a really critical issue, is how do people find out about what's available in their community? And very often, the people who call the elder care locator a toll-free national number because they don't know where to call in their community to get answers to their questions, or they have called 5 different numbers and still not found the answer to their question. Or, again, it could be that there just is no answer, that there is not transportation to serve them. So those things are really critically important. Mobility managers do an amazing job in that they really have kind of 2 roles. One is to help people understand what's available and to help them figure out, okay, I have to go to kidney dialysis. And when I go to kidney dialysis, I may not feel great, but I can still ride the bus to get me to the appointment. But when I'm done with the dialysis, I'm going to feel sick. And actually, maybe I might not even feel comfortable traveling alone. So how can I ensure that the kidney dialysis that likely I'm going to 3 times a week, that I'm going to be able to successfully go from my home back home at the end of the appointment and get the treatment that I need? Very complicated issues, and they're very community-based, and we really do need a lot of information online, but there's no substitute for that personal assistance that people sometimes need. So I'm going to talk very briefly about a grant program, and I feel like you let me know if I'm running out of time. So we did a program in 2017, not a lot of money. We funded 6 communities, up to $50,000 a piece. They had 12 months to do it. We had a number of purposes. We wanted people to strengthen the connections between transit and the human services programs in their community, and to build bridges and to identify innovative ways that that community could better ensure accessible transportation for older adults and people with disabilities that live there. And so these are our projects. And again, I'm not going to go into a lot of detail about them. We have information on our website about all of these. But I'm going to say a couple of things. One is, in terms of talking about rural transportation, but it isn't just an issue in rural transportation, but it's a big one in rural areas, is this whole issue about jurisdictional boundaries. So many programs are county-based, and very often in a rural area there is a regional health center that people have to get to that may not be in your county, but maybe 2 counties over. You talked about, Alicia, about the distances that people travel, but it isn't just the distances, it's the jurisdictions that they travel through. And figuring out a way to ensure that programs connect to one another and that people are able to seamlessly get from one point to another that may be at some distance from them. And it's not just a medical issue, it's often a shopping issue. Where can you get the cheapest food in the region? That may be a 20-mile trip away to the Walmart. And how are you going to get there? The other issue that has been mentioned is this whole issue of transportation during the week. And one of our projects created weekend and evening trips and found that there was a real target audience for that service, because a lot of people, because of the transportation that was available up to then, were not able to travel on weekends. They couldn't go to worship services, they couldn't play bridge with friends, whatever. So recognizing that. And then another project in Mountain Empire Older Citizens, one of my favorite organization names in the world, which is in Big Stone Gap, Virginia, which really covers a very wide rural area. They do very creative programming, and they wanted to focus particularly on people with chronic care conditions and helping them get back and forth to medical appointments. They use a dial-a-ride system, which is basically an appointment system, but it's a group ride. And so what they did was they found that some people needed someone to travel with them. And so they have a combination of paid and volunteers who actually ride the bus, help people on and off the bus. They don't actually go with them to the appointment, but of course their family caregivers can travel with them if necessary. And there were several of these projects that also created a central call number for the arrangement of rides, because that is something that crosses, whether it's an urban or a rural area or a suburban area, getting access to that information and actually being able to talk to a human being becomes really critically important. Partnerships, really important. Flexibility, the ability to recognize that when we're providing a little bit of money to a community to do a demonstration project, it is a learning experience, and sometimes the best laid plans fall apart and you have to make some mid-course directions, and it's really important to be able to do that in a community project and to build on what's already in place and to ensure that you aren't just creating a 6-month or 10-month program that is going to disappear. You have raised expectations in your community, so it is important to have some continuity. So now I'm going to turn my attention to another project that I've been working on for about the last 5 years. It's funded by the Administration for Community Living. Again, it's a partnership of organizations, and N4A is one of the partners. It's called Transit Planning for All, and it's really about this whole notion of bringing not just the concerns of older people and people with disabilities to the table, but actually bringing older adults and people with disabilities directly into the planning process, and recognizing that, yes, we're all very knowledgeable. I've been working in aging since, oh God only knows, a really long time, almost my entire career. And I feel like, hey, I know a lot about aging and aging services, but there are things that I hear through talking with older people directly, talking to my parents directly, that sometimes surprise and amaze me, because the experience that people have cannot be predicted, and it's really important to figure out what people not just need, but what they want and how they want to be served. It isn't enough to create a really good A1 service. Is that service something that people like, that they will use, and that they can use successfully and feel good about? So we have funded a number of rounds of local projects, all of which are designed to bring people together to talk about how to improve the transportation in their community. These are what we call our pioneer projects. We funded them through 3 rounds of funding, and they really, I think, got it. There are several things. We're getting ready to fund another round of these projects. As a matter of fact, we have an RFP on the street now that's due May the 3rd. And the thing that we have learned from these projects is that it takes time to build a coalition of people willing to work with you. Not all older people, not all riders of buses are willing to be part of your coalition, which you've already found out. So it does take a certain amount of persuasion. It does take a certain amount of kind of beating the bushes and trying to find people, and not just the usual suspects, not just the usual members of the community advisory board, but people whose lives are really impacted by the quality of that transportation. We've had people do focus groups, we've had them do phone surveys and written surveys, to do interviews, individual interviews, and to take the meetings where people are, so to go to local churches, to go to senior centers, to go to the library, to go where people automatically gather, rather than saying you've got to come here, and ensuring that people can get there. So some of the funding has been used to actually transport people, to bring them together. And also to recognize that figuring out what's going to work, it may be an experimental thing. Some things will work better than others. But also to get people to come together, to have conversation, to come to consensus about how to improve things in their community, recognizing that what's going to work in one community won't work exactly the same way in another, even though you can learn from those communities. This is our most recent round of funding, and a couple of things. One, it's really important to empower and educate people, and to recognize that there are professionals who are going to be part of this process who know the transportation system upside down and sideways. There are people who come to these gatherings that don't know how things work. And one of the things that we found with a couple of these projects is people have to come to understand that just because you've made these great recommendations, funding cycles don't happen at your whim. They happen on a certain cyclical schedule, and it may take a while to bring about the change that you're looking for. So people need to understand that kind of going in, so that their expectations, they really want to make things better, but they really need to also understand what's realistic in the community. And inclusion and co-design, to me, If we're ever going to improve transportation and really ensure that older people and people with disabilities are able to travel around their community and stay connected, we have to include them from the outset. Whether we're creating an automatic vehicle or whether we're creating a plan for improving transportation, we really need to have the users at the table from the outset. And with that, these are our new opportunities for funding that we have out on the street. And I'll stop there. That's my contact information. Thank you.
What is the phone number for the national?
It's on the slide. It's 866-983-3222. That's our toll-free number. And if you want my number, I'll gladly give you a call. Yes, ma'am. Oh, sorry.
Thank you for a great presentation. One of the spreading epidemics recently is elder mistreatment, elder abuse and neglect. And we know that 1 of every 10 older adults is being misused, neglected and abused. The problem is actually that we only know about 1 of every 20 cases of neglect and abuse. This is what research have shown us. So almost 19 cases goes unnoticed. Do you think that drivers in this program can help us screen and identify neglect and abuse? And I want to add one more thing. It's not as simple as asking the older adults if they're being neglected and abused, but it's more of telling them the effect of neglect and abuse, because most of the cases, older adults are trying to protect the abuser because he's a family member, or because they're afraid that if the abuser is taken away, there will be nobody to take care of them. So do you think programs that will train the drivers to screen and identify neglect and abuse could exist in this program?
I think it's very important. As a matter of fact, I showed a couple of our recent publications, and one was really, it had been a smaller publication, and we expanded it, called Dementia, Caregiving, and Transportation. And we have a couple of purposes in putting that together. One is to teach people with dementia, as well as family caregivers, about transportation. But the other part of that is to educate drivers and the transportation world about dementia and some of the signs of dementia. We know that, for example, in most public transit programs, the drivers often know who rides their bus every day. They know a lot of times, they know them by name. And that's true certainly with volunteer programs as well. These folks really can tell when something's going wrong, when people are not the same as usual, when they may be experiencing a health issue, a mental health issue, or they may actually be in the early stages of dementia, because we know that especially folks without family caregivers, but also with caregivers as well, until they reach a certain point in the development of dementia, they are still living their lives. They're still out there in the community. So it's really important for all of us to be better educated about what's going on. And I will just say that I don't know if you all are familiar with Dementia Friendly America, which is a new initiative that's actually based on a project that originated in Great Britain. And the whole point is to bring people together in the community to learn about dementia and to learn how to interact with people with dementia. It's a really, I think, critical development.
Yes, I applaud everything that you're doing. I have a question, and then really a question for the whole audience or a challenge. And that is, you're talking about systems, but there's also the part, I'll call it hardware. So we have a lot of issues with buses, with cars, with whatever shows up when you call for a ride, and the person who's there now can't get into the vehicle or can't get out. Or they show up and they have a rollator or, wheelchair and it doesn't fit in the car with them. So, have you looked at, and through all of your discussions, tried to brainstorm new and innovative designs for transportation?
Design is something that we really haven't spent a lot of time on, so I appreciate your bringing that to our attention. One of the things that we do advise people in the community is that a lot of times older people or people with disabilities need more than a ride, and I think that's a critical issue, that getting in and out of the house may be the issue. Walking from the door to the vehicle, actually getting in and safely sitting in the vehicle and buckling up, and then being able to store a walker or a wheelchair or having access to a wheelchair accessible vehicle. All of those things have to be part of that, matching people's needs to the service that's available.
But I throw it out there probably to the audience, because in small towns, you don't have much choice what kind of vehicles. There's whatever's there is there, so you're trying to work with the best. But I think academics need to now redesign transportation.
Absolutely, and I will say another thing, that family caregiver issue. My mom's in a wheelchair, and fortunately I have enough upper body strength to be able to lift the wheelchair and put it in the trunk of the car, but not everybody can do that. And as our loved ones are living longer and longer lives, and we are aging ourselves, this issue about being able to really provide the care and support that your mom and dad need becomes an issue.
Yeah, just quick sort of thought outside the box here. How many of the non-medical emergency visits could be replaced by telehealth visits?
That's a good question, and I think telehealth is something that needs to be definitely on the table. It is one of those, isolation versus non-isolation issues, but certainly I think a lot of medical issues can be addressed through telehealth, and I think it is something that we need to include in the mix.
Any more questions? If not,